The topic for today's presentation is TMD can feel like you are having a heart attack. Does that surprise you? I'll tell the story, but actually, we have had episodes of patients. We've had experience now with 3 separate patients who have documented TMD, have most or all of the other symptoms associated with temporomandibular joint disorder, who relate that they thought they were having a heart attack. And I'm going to explain to you the pathophysiology, exactly how that occurs. So the story is that several years ago, I had a patient present to the office for consultation regarding TMD. His dentist thought that the patient had enough symptoms that they sent the patient in to see me to do a consultation and to see if I could help the patient. In the middle of that consultation, the patient shared with me a story that recently for him, he had actually gone to the emergency room, the emergency department of the local hospital, because he was having a heart attack because his chest was hurting so severely. His chest was hurting so severely. So I listened to that. I kind of filed it away. At the time, it didn't make any sense to me. He had all the other symptoms of the problem. He had hot joints, painful joints. He had frequent or recurring headaches, earaches, neck pain, jaw pain, and this funny story that he actually recently went to the emergency department and thought he was having a heart attack. Well, I filed it away. I didn't do anything with it until about a year and a half, 2 years later, another patient, female, comes in. And in the middle of the consultation, she shared with me part of her history that she had recently presented to the emergency room at a local hospital with chest pain and thought she was having a heart attack, and how that the emergency department worked her up and did the ECG, drew some blood to see what the troponin levels were. Troponin levels L and I would indicate muscle damage, and they were all normal. They were normal.